Good afternoon, folks. Welcome to this month's Inspection 360 webinar from Evident Scientific. I'm so glad you joined today. I'm Michael Hall. I'm one of the X-ray specialists here at Evident Scientific, and I'm going to kind of host our webinar today. And we're really fortunate to have with us Dr. Jenna Forsyth from Stanford University, which I'll introduce in just a minute. But I want to sort of orient you to the webinar. When you logged in, you should have seen you got a little dashboard. You can adjust your screen to have the camera and the screen size the way you want it. There should also be a sort of dashboard on the side where you can put questions into the questions box. And I'll be monitoring that questions panel throughout the presentation. And we're gonna have lots of time at the end for Dr. Forsyth to answer all of our questions. And so I'll be engaging with you there in the questions, and then I'll pose all those questions to Dr. Forsyth at the end. So please, please put your questions in there. Don't wait to the end, but we'll make sure that they all get answered as we go along. At the end of this presentation, about an hour after the presentation is over, you'll get a link to the playback. So if you want to share it with a colleague or listen to a portion of it again, you'll be able to listen to that playback and have that available there to you. So I'm really excited about today's webinar. I've had the privilege of knowing Dr. Forsyth for several years now, and just been really enjoyed following her research and the work that she's doing in public health. And I think you're going to see today, besides, there's sort of a stereotype of professors in academia just sort of living in an ivory tower and thinking about grand ideas, but not really impacting the world. And you're going to see that Dr. Forsyth is the best kind of scholar because she's doing cutting edge science and public health work, but she's not just sitting in an ivory tower. She's out on the front lines impacting the lives of everyday people. And so I don't want to steal her thunder because she has a great story for us today. And so with that, I'll turn that over to you, Dr. Forsyth.
All right, thank you so much. Thanks for that nice introduction, and I'm really happy to be here. Just first to check, can you hear me and see my presentation and see me?
Yep, we can hear you and your presentation's clear, so thank you.
Great. All right, so I'll get started here. Yes, as Dr. Hull has mentioned, I'll share a bit of my work to identify and eliminate lead sources, especially a spotlight on our work in South Asia around spices. So I am now a research director at Stanford in this initiative we have, which is called Project Unleaded. And just to give you a little bit of a background on that, and I put the QR code here if you want to take a look, but don't worry about finagling it now. Dr. Hull will also share a link to that later. But essentially our initiative has kind of three pillars in approaching our work toward a lead-free future. And the first is research to identify and prioritize the most important sources of lead poisoning globally. The second is research to develop, test, and scale up interventions to eliminate sources of lead. And the third is research to advance field-appropriate rapid lead measurement techniques, which are really important in these lower resource settings that you'll hear more about. So in today's talk, I'll go through first an overview about lead exposure, and then I'll share our series of studies that we conducted to identify and address lead poisoning in Bangladesh related to spices. And then the third is I'll kind of share a little bit more about what we're doing with spices more broadly. And I'll end with a conclusion and a little bit of a call to action, something I want to share with you as well. So first of all, why do I care so much about lead exposure and lead poisoning? So, lead is a potent toxin. It's actually, it has no safe levels, it has no purpose in the body. It's actually toxic across all of our systems in the body. So in the cardiovascular system, lead can cause increased risk of cardiovascular disease and stroke. In the endocrine system, lead can lead to renal failure, and lead can easily cross the placenta and enter the brains and wreak havoc in the brains of children as they're developing, as well as adults in their brains as well. So This research on lead's impact on cognition and on the brain has been ongoing for decades. So we know a whole lot about this, and I could spend the whole hour talking about it, but I'll just give you a snapshot. This is a composite MRI image of 157 people in the US who are followed from birth through adulthood. And this shows that the orangish red portions of this image show where there's a reduction in brain volume due to childhood lead exposure. So there's actually, lead makes your brain smaller. So I mean, given that, it's not too surprising that lead also is associated with lower IQ, associated with depression, increased risk of aggression and behavioral disorders, and it's been linked with violent crime. And then in the cardiovascular system, lead can result in clogged arteries, higher blood pressure and hypertension, heart attacks, and then death, of course. So, you know, when we look at this burden of disease from lead globally, we see these staggering results. You know, a 765 million IQ points lost from lead exposure, over 5 million deaths from lead exposure related cardiovascular disease annually, and this huge cost of, you know, in the trillions of dollars, or, you know, over 5% of global GDP. The good news, I would say, is that, you know, we've seen that the world can do something about this. So, you know, in the 1970s, lead was in gasoline and blood levels were very, very high. We've seen, you know, a 70 to 90% reduction in many places in the world in blood lead levels after phasing out lead in gasoline. And that's what this figure shows. It's from a meta-analysis of studies looking at the reductions in blood lead levels across the world after phasing out lead in gasoline. This one here focuses on countries in Europe, although the trends are similar no matter which continent you're looking at. And, you know, so we saw these great advances and these great progress in reducing blood lead levels after phasing lead out of gasoline. The Center for Disease Control has set these different blood lead reference values throughout time. So in the 1960s, this was at 60 micrograms per deciliter, which is actually off the charts here. And then as we get more evidence with lower and lower blood lead levels, they reduce this reference level, and now it's set at 3.5 micrograms per deciliter. What we see across the world today, though, is even 10 years after phasing lead out of gasoline, we see elevated blood lead levels, especially in certain parts of the world. And that's what this map shows. So this is a literature review done by Brett Erickson and others most recently. And what they did is they looked for studies conducted at least 10 years after phasing lead out of gasoline. And these different shades of blue show the blood lead levels in those different countries. And what you can see is that, you know, there's some parts of the world where we see darker blue and higher blood lead levels, especially in Africa and South Asia. But if we look in globally, we see 1 in 3 children suffer from lead exposure at levels that will cause permanent cognitive damage. In those lower income regions, it's 1 in 2 children. And you can see in South Asia, we see pretty high lead levels across the board, especially the darker small country there is Bangladesh, where I've done a lot of work. So that's kind of why I've focused on that region since my PhD and as part of this initiative. But what this data doesn't show us is where the lead is coming from. You know, why is it that after getting lead out of gasoline, maybe lead out of paint, we see these high levels still? This data set represents 34 low and middle income countries, and about over half of them, over half of the studies that comprise this data set just had no lead source identified. So this is a real focus for us, and this has been really important within our initiative. We think it's a really pressing question to understand what the priority sources are that are continuing to cause this outsized burden of lead poisoning. So, you know, identifying a source of lead poisoning is often not so straightforward. Usually at the time of assessment, exposure has already occurred. It's out of sync with the time of exposure. Exposure may have occurred months ago. Exposure can be pretty complicated. It can be a complicated web of different sources. So ultimately it can be from industrial pollution or products, cosmetics, paint, pipes, and this can contaminate the air and the we breathe, the soil and dust around our homes, the food we eat, and the water we drink. And ultimately this results in lead in our blood for a shorter period of time. It has a half-life there of about 1 month, and then lead in our bone or tissue for much longer, over years and decades. So when we're actually doing these assessments, we typically do blood lead assessments, and we look backward for these exposure sources, usually on a period of a few months. When we're looking at pregnant women, though, the lead can mobilize from the skeleton of the woman, especially if they have lower calcium in their bodies, and we can see higher blood lead levels during pregnancy that represent longer term exposures as well. So it's a bit complicated, and we focus on different studies and techniques to understand this better. And I'll share with you one case study, and we've since done others. So when I was a PhD student, I started off and I was, given this preliminary data set suggesting that there were really high levels of lead exposure in rural Bangladesh. So this isn't a place with industry. It's like this beautiful verdant landscape like you can see here. So, these were rates of lead poisoning many times higher than in Flint, Michigan, for example, during the peak of the water crisis. So I was really struck with this question and this puzzle, why would there be such high blood lead levels in this rural part of Bangladesh? So I worked closely with collaborators from Bangladesh, this institute ICDDRB, as well as collaborators from Stanford and Johns Hopkins University, and we conducted a case control study. The population was this representative sample of over 5,000 pregnant women from 4 different districts in this northern rural part of Bangladesh. And via a literature review and looking and going around the homes and kind of an anthropological study, we had some hypotheses about potential sources. One, this was really an agrarian community. These were agrarian communities. So we had hypotheses that potentially agriculture-related exposures dominated. Maybe lead arsenate pesticides still existed there, or other sources from agriculture. There was no known industry. There wasn't dominant industry or battery recycling in this area that we found, and there was no paint or ceramics in the homes. These were not painted homes. These were tin homes, and lead had been phased out of gasoline for much over a decade at this point. So when we did the blood draw and we looked at the blood lead levels, we saw this skewed distribution, which is really common. You can see here, this is a histogram. On the y-axis, you have the number of women, and then the x-axis is their blood lead level. But what you can see is that for this rural region, over half had above that CDC reference level of 3.5 micrograms per deciliter. So in a true epidemiological approach, this case control study, we enrolled people with the highest blood lead levels as cases and those with the lowest as controls. We conducted exposure questionnaires, conducted sampling of soil and water and other things, and tried to compare them. Why did the cases have high blood lead levels? So our first approach was to do this epidemiological analysis, a logistic regression, and really it looks at what are the odds of having what are the characteristics or the exposures that are linked with a higher odds of elevated blood lead levels. And we found 3 possible exposures. The first was consuming food from a can, grinding rice, and applying herbicides. All of these were more than 2 times likely to be reported among those with high blood lead levels, the cases. So what we did next is we went back to test these samples, do kind of some basic testing, and also to go back to the communities to see if there were other sources we might have missed. When we went back to to these communities, we talked with the pregnant women a little bit more. We learned that some of them were practicing what's known as geophagy, or consuming soil and clay. In this picture on the left, you can see a man selling clay pottery, but he also sells specific small clay tablets that were marketed toward pregnant women to alleviate pregnancy-related symptoms. And also women reported scraping the soil from these earthen burners to put in their mouth as well and consume. And we also found a small study published around this time from the capital, near the capital in Bangladesh, suggesting that turmeric might have elevated lead. This was only a sample of 20 or so children, so it wasn't much, but we went back and sampled a subset of these households, and we asked for spice samples, especially turmeric, and we actually found really high levels among certain women, over 100 times the lead limits. So this piqued our interest. But we didn't find lead in those other sources identified as part of the logistic regression. So when we put this together, we had this epidemiological approach that said maybe it's cans, agrochemicals, or rice. And then we had this chemical approach that said, well, actually, there's no lead in the agrochemicals or rice, but it could be cans. And what about turmeric and geophagy? So we had ultimately these kind of three sources to look at. And I'll just take a moment to pause here and mention that this is, part of this messiness of identifying priority sources. You can't really rely on a single approach. So on the one hand, this epidemiological approach had some strengths. We can ask many questions and statistically see and how, we can connect exposure to outcome or the high blood levels. And we can do this with many at once. On the other hand, it's really difficult to understand we can't capture common exposures. So turmeric, we did have a question about it in our survey. It was assessed as part of the logistic regression, but everyone said, yes, we consume turmeric daily. There was no link with the lead levels, which were variable. And then the basic chemical testing, just knowing if there's lead in a product can give an indication of potential severity, but of course it's unlinked to human behavior and exposure and the frequency of consumption, which would really determine how much ends up in the body. And of course, a negative result having no lead, like in the case of the agrochemicals and the rice, doesn't really rule out a pathway. It could actually have been a historic pathway, but we don't have present day evidence of lead contamination. So at this point, we had a question, which sources among the turmeric, the cans, and the geophagy, which were really contributing most to the human lead burden? So we turned to this isotope-based study, and I like to refer to this as kind of chemical forensics, basically a way to chemically link lead and sources in humans. And there are a few different approaches we can use for this, and isotopic fingerprinting is one of these tools. And what this means essentially is there are 4 common lead isotopes that differ slightly in mass. There's 1 stable and 3 that are radiogenic. And the ratio of these isotopes, or the isotopic fingerprint, can indicate the age and origin of lead. And sources of lead may have distinct isotope ratios if they come from different origins of lead ore. So we conducted this. We first looked to see if our hypothesized sources had different levels of, had different isotopic fingerprints. And that's what this box plot is showing us. On the y-axis, we have the isotopic fingerprint, that ratio of the lead 207 isotope to the lead 204 isotope. So it's not a magnitude really we're looking at. It's just like each source has these different fingerprints. And the box plots show the range of values, this interquartile range, the 25th to 75th percentile, and that white bar in the middle is the median, or the 50th percentile. What we can see is that these did have distinct isotopic ratios. The geophagia samples were more similar to the geology and the rocks of the area, and the turmeric and the solder from the lead soldered cans were also smaller ranges, but distinct. And when we compared with the blood, we actually found that the lead in the blood matched the lead of the turmeric the best. The turmeric isotopic fingerprint range explained 85% of the blood-lead variability. So this was really exciting. It was nice to have this concrete evidence to pinpoint that we could focus on turmeric. This also matched with our other evidence. We found that the rates of consumption of turmeric were just very, very high. It was one of these top spices consumed daily. The lead in the solder from the cans was mobilizing less into the food in the cans. We did some experiments around that, and the prevalence of this and the frequency of consumption was less. And same with the geophagy. So overall, both the isotopic work and the kind of general understanding about human behavior and exposure modeling suggested we should really focus on turmeric. So we had this question, why would there be such high levels of lead in turmeric? What's behind that? What are the incentives of what's going on here? And also, how widespread is it across the nation? So we conducted a mixed methods supply chain study. We wanted to sample all the different types of turmeric from the major supply chain areas where the major turmeric production is happening or major distribution is happening. And that includes the fresh turmeric on the left here, the dried, unpolished roots, these polished turmeric roots that have the brighter color, the loose powder, and the packaged powder. We quickly found that the levels of lead in the polished roots were excessively high, as well as the levels of chromium. So we found lead to chromium indicative of a lead chromate industrial pigment, the bright yellow pigment at this polishing stage. When we conducted more interviews and observations, we learned a little bit more about this. We found that people who know true turmeric quality break open the roots and look at the inner color, like this man is doing here. They look for that bright yellow inner color, and they can't be fooled by what the outer part of the root looks like. However, there's this polishing process to rub away dirt and debris in these large drums that they spin around, and the dirt and debris falls off and the outer skin of the turmeric rubs away and the inner yellow comes to the outer part. And we found that people were adding lead chromate to kind of reduce polishing time, so that increases profits. Also to make it easier to sell poorer quality turmeric, kind of to fool people in thinking it's a brighter, better quality root. And that there were these floods that happened in the 1980s that really damaged the turmeric root, made it hard to sun dry, and that really was the catalyst to starting to add lead chromate to these roots. So we went around to the districts across Bangladesh in the regions of Bangladesh where the most turmeric production was happening, and we found we had a protocol where we looked for evidence at these polishing mills, the evidence of adding lead chromate in these pigment bags or pigment containers. We also sampled and tested for lead and chromium in the dust underneath the polishing machines and the dust inside the polishing machines, and also the roots before and after polishing. And what we found was that it was really widespread across the nation. This map shows in the different degrees of orange color, the percent of polishers that we found evidence of using pigment. And nearly every district we sampled had some evidence of using the pigment, but in the north and northwest region, there was the highest prevalence of adding lead chromate. So now that we knew this, we actually had been working with the government for quite some time, but the government, we have been meeting with them yearly, and they said, you really need to publish these findings before we start to take action. So we published, we kind of timed the publications. First, the message and the isotopic fingerprinting roots saying, this lead chromate in the pigment is increasing blood levels, and then the second really showing the incentives behind this and how widespread it is across the country. And so this was really important to the government to have credible evidence in these peer-reviewed publications before they could take action, because there are a lot of food fraud scandals and they needed this evidence documented. So at this point, we wanted to work toward this intervention. Really, how can we ensure turmeric can become lead chromate free, and what can the impact be? So we worked with them, and this was always my goal from the get-go. When I started my PhD, I remember asking, I want to do something that makes a difference. Can we just focus on solutions? So we had to get this problem stuff out of the way before we focus on solution. But this was just a really exciting time. So working closely with the local government and our partner ICDDRB, we decided to do this pre-post analysis of lead and turmeric, as well as the blood lead levels of occupationally exposed workers and pregnant women before and after an intervention. We developed the intervention with this participatory-based approach, so the government had a big role, as well as the industry people in the turmeric industry. And we had three different components. The first was raising awareness. So we wanted to steer the media coverage around our work to be very solutions focused. We had seen there were previous recalls of lead and turmeric. This was, this had been known, it had been happening for decades, but sometimes the media coverage was a bit vague and not very solution focused. Just, oh, this is a big problem. It's not clear where the lead is coming from, but we wanted to really have this laser sharp focus in the media coverage about, we know where the lead is coming from. It's not just the soil, it's this lead chromate pigment, and we know that we can do something about this. So then the government also distributed 50,000 posters warning consumers and sellers about the dangers of lead chromate added to turmeric and showing them how to identify it, and also warning them that they would start enforcing this policy. There actually had been a policy disallowing lead and turmeric in Bangladesh above 2.5 parts per million, but it hadn't yet been enforced. So this is this picture you can see in this poster that they distributed to all the markets across the country, saying don't go for that bright yellow route, go for the less polished route. We also did some face-to-face outreach. Our team at ICDRB went around to polishing mills, especially these really key polishing mills, to talk to them about this issue. And then, really important step, we used the portable X-ray fluorescence analyzer, and that this allowed the government to finally enforce its policy. And they fined 2 wholesalers, and they confiscated nearly 1 ton of roots during this time. This was in 2019. So here are a few images from this. Here's some of the media coverage. Here's some of that face-to-face outreach I mentioned at the polishing mills. Here is a bit of the media coverage of our team using the XRF to kind of build capacity with the government in the field, showing the Food Safety Authority. Here's these roots actually, you can screen. These had excessively high levels of lead and chromium. This encouraged the government to also do some of their lab testing, which was their routine, but they just hadn't done because it's very cumbersome. Anyway, then they had gone, oh, excuse me, let me see if I can, here we go. Then after, screening with the XRF, confirming with the lab, this was what they call a mobile court, where the magistrate goes and they confiscate the roots, find the sellers, and uphold the law and enforce the regulation. So, before this pre-post analysis I mentioned, before this intervention, we found about 47% of the turmeric sold at this major bazaar in Bangladesh had elevated lead, indicative of lead chromate. And after the intervention, we saw this drop really dramatically. So this data has kept going, and we've seen this sustained. I'm also not showing, in the interest of time, not showing all the other results about the reductions in occupational exposure from those blood levels of the polishing mill workers, and evidence of reduction of the pregnant women's blood levels. But we have that's kind of forthcoming. So this was super exciting. Of course, the media also, to no detectable lead within 2 years of this intervention. So it's just great to see this progress. Some takeaways from this, essentially, having this interdisciplinary research really helps to identify turmeric, and it's really possible to eliminate these long-term sources in a short time with participatory research and these government partnerships, which are really key. And in this case, focusing on these 3 pillars around awareness, improving detection, especially this rapid detection with XRF, and good enough governance. I mean, this was a one-time policy enforcement, but that it was a big splash, and that really helped. Plus, the industry people were aware. So even if there's government turnover, the industry people were knowledgeable now about the harms of lead chromate. So, some incredible journalists covered some of this. I'm grateful to them because I think it really also helped spread the word and motivate others around this too. We had some work at, Chris Newby at Stanford did some coverage of this, others from Vox, The Lancet, Uran Yan from Undark, and some coverage within The Economist. And this article of The Economist really points a finger, it says, asking about, what about other countries, right? And that was in my mind for a long time. Of course, now it was the pandemic, so I was thinking, how do we do this? But I had this question, like, how widespread is lead chromate turmeric adulteration across the rest of South Asia? It's, India's the major producer and exporter of turmeric worldwide, and how do incentives vary around this? So since 2020, and actually this has been different phases. We had a first phase in early 2020, and we've had a second phase of this research much more recently. But essentially, we've been looking across the other countries in South Asia, India, Pakistan, Nepal, and Sri Lanka, to understand the prevalence of lead chromate turmeric adulteration. We sampled from, the largest geographically dispersed cities. Again, this is a little bit of a citizen science because we couldn't travel ourselves. Using this mystery shopping protocol at major wholesale bazaars and retail bazaars in each city, and we sampled several hundred different types of turmeric available. And this graph here shows these results. So these are little pie charts showing in orange the proportion of samples with above the India limit for lead and turmeric, which is at 10 parts per million. And what really stands out here is, we saw, fortunately, many cities had lower levels, but we saw several cities with evidence of lead chromate turmeric adulteration. And because of the nature of this type of sampling, if you see an issue, usually the issue is much bigger than what meets the eye with this kind of sampling. So what really stood out, of course, was this city in North India in the state of Bihar, where there was turmeric with lead levels, several hundred times higher than what would be considered acceptable and normal from the background soil and indicative of lead chromate. And in this case, all of the samples from the city had elevated lead, but all but one had above that 10 parts per million. So we've gone back and we've been doing more work here. The government is very eager to take action and really hopeful to see what comes of this. At the time, we also had been doing a study. Some colleagues were leading a study. Mary Jean Brown was leading this study to look at blood lead levels among children in Bihar. Blood lead levels were quite high, and that study also found elevated lead in turmeric, as well as levels indicative of lead chromate in other spices like coriander and chili. Our subsequent analysis suggests that it's cross-contamination from the grinding equipment. That's the reason there's lead chromate in the chili and coriander, and not adding it directly, which kind of makes sense because these are not yellow spices. But we're continuing to do more work around this, and we're continuing to understand incentives and really build those partnerships with the government and local change agents to see the same progress. And we're really hopeful about that. So look for this to come. We should see more good news, I hope. So just before I close here, just a look at the adulterated spices. I told you a little bit about our work in South Asia. I want to mention that we did some work in the Republic of Georgia, a very small country, but it had super, super high lead levels in spices and also in the blood. And UNICEF and Dr. Paramita Hore and Dr. Brett Erickson and Dr. Alan Wolf have also done some studies around this. So this is an important area where spice lead levels were quite high, but fortunately we see some good news here too with government actions, similar efforts. We saw some reductions in lead levels. We've done a little bit of work in, you may have heard about the cinnamon case in Ecuador and the applesauce pouches that unfortunately poisoned hundreds of children in the US and elsewhere. So looking into the reasons why lead chromate would be added to turmeric lead chromate would be added to cinnamon as well. That kind of work is ongoing. So before I close too, I just want to mention, the government had a policy in place. They had a plan to sample turmeric. So in Bangladesh, they had this policy in place disallowing lead in turmeric, and they had a plan to sample and test lead and turmeric at their laboratories. It is really hard for them to do those tests. It's hard to get the samples, to incentivize people to get the samples and to complete the tests. It can take several weeks of turnaround to do this laboratory type method with several steps involved, need for trained laboratory analysts, need for different consumables, argon gas, et cetera. So, I think really it underscores the utility of the XRF and other rapid tests for not only scientists, but also governments and individuals. And so we're continuing to think about this. So I just want to mention, obviously, the XRF, the X-ray fluorescence analyzer, is a hugely important component of this. And in India, for example, there's an approved method for detecting lead in turmeric, but we are really hopeful to get an XRF method validated and get it in the books, because I think that'll open up a lot of possibilities for better enforcement. There are colorimetric methods. Sorry, before I move on from that, I should say this is from a study that Dr. Alondra Lopez led, and she looked at the relationship between the XRF values for different spices and ICP-MS laboratory mass spectrometry techniques. We saw a really good correlation. So we think this provides the launching point to have these internationally approved protocols for XRF, especially for the first stage screening for lead adulteration in spices. And then there are colorimetric approaches that have certain uses too, especially when you look at the whole spices. It's a little harder with the powdered spices because you have to add different steps like ashing. And there are also potentially other methods that we're interested as well. So yeah, there's a lot of need for this to make sure that those barriers to testing don't detract from an ability to enforce the policy. So anyway, just in conclusion here, I hope I've shown you a little bit about the importance of this evidence in terms of source attribution to really identify and prioritize neglected sources of lead poisoning and to galvanize local investment and to allocate local resources to change. And then, spices still represent a widespread source of lead poisoning. If we look at that map I showed, although it's just a few cities, that's, several 100 million people are probably still consuming lead chromate adulterated spices in South Asia, unfortunately. So we still have work to do there. And like I mentioned, this importance of rapid lead detection, especially with X-ray fluorescence analyzer, it's hugely beneficial to move quicker to enforce policy. And just to end, there's no safe level of lead. So we still have more work to do. Colleagues of mine, Dr. Steve Luby led this opinion piece that I want to point you to if you want to take a look at this. It's a commentary in the Lancet Planetary Health, kind of a call to action to kind of everyone across private companies, and to really remove lead from the global economy. If we look at this little, you can read more about it if you open up the article, but this little chart shows, this little picture is trying to represent how, if we even just take one product, batteries are 85% of the products that have lead in the economy. The industrial profits from the battery industry are so small compared to the harms that lead causes. So, it's a couple of orders of magnitude, over $6 trillion in harm, but less than $100 billion in these industrial profits. And yet we know, and we've known for so long, that lead is just toxic across all systems, including humans and across the environment. So, yeah, thank you so much for your attention today, and I really look forward to questions and discussion. Thank you.
Thank you, Dr. Forsyth. That was a great story and great work there you got to share. And we got really good engagement in the questions, and I would encourage everyone to keep posting your questions here, and I'll start posing them to you, Dr. Forsyth. The first question was not planted by me, I promise you this, but actually the first question we had was to ask if you could just elaborate a little more on how you use the XRF analyzer in the field. And I think maybe you, depending on where you were at and what kind of testing you did. So could you just sort of describe some of the ways you use the XRF? And I promise this was not, I didn't send in this question. So.
That's funny. And I realized I didn't talk as much about it. I wasn't sure how much knowledge the audience had, but I'm really glad, I'm grateful for that question. Yeah, definitely. Actually, it's funny. When I talked about our first period of work in rural Bangladesh, at that time, we didn't have an XRF. We didn't use an XRF. So I was in the lab all the time doing the analysis. And I was just so grateful to get the XRF. So essentially what we use with the XRF primarily is we use it as a first stage screening typically. We use it in different ways, but essentially when we don't the video showed someone pointing the XRF at a burlap sack full of turmeric roots in the market. We actually don't do that. That was part of the government wanted to do that as part of their kind of awareness raising. Actually, they wanted to show that they're serious. They have this, that was something that they wanted to show. But that's not our typical approach. We typically will take a sample. We take about 50 grams of the sample. The XRF correlates best with our ICP-MS results when we use the powder spice. But we have two calibration curves. We have calibration curves we've set up, we have a set of samples, like 5 to 10 samples of turmeric powder or spice powder and the turmeric roots. And so we test those with the XRF. We have their known concentrations from ICP-MS, and then we test our samples. Usually it's done in the field by the partner, so not actually with a sample, the full setup that we could do, although that helps obviously if we were to use the sampling cups. But typically we'll just have a really thin, clear polyethylene Ziploc bag, and then we'll test it with that. And so most of the testing is done outside the market in our laboratory, our different field laboratories.
Yeah. Great. And can you elaborate a little bit on you mentioned you're working to get a method approved by the Bangladesh government. Is that going to be unique to Bangladesh or more broad? I know you're doing some work with USAID and the UN. I think someone posed a question. I think they're really concerned about sort of validation and acceptance. So maybe you can talk about where that effort's going.
Yeah, actually, the motivation for that validation especially has been with India. So the Indian Food Safety Standards Association essentially has these different approved methods, and we think it would be very valuable to get the XRF method approved, especially for India, but honestly having an international standard, kind of like your ASTM standards or any of those standards, that's our goal. So we'd look for collaborating. If anyone on this call actually wants to be a collaborating lab, we'd need 6 different labs to vet kind of this approach. We're working on this with Paint with a couple of other collaborators too, to kind of get the pre-processing right enough with the XRF so we can say and we can state the bounds and kind of the performance. But yeah, I mean, the motivation has been the work with India, and however, we'd love for it to be an international standard, and an internationally accepted protocol.
Yeah, great. Maybe you could pull back up your slides. I think there are a couple of these questions you may be able to support your answers with the slides, so I'll give you a heads up to post there. But the first question asked about the accuracy of the XRF relative to laboratory analysis. And I think you had at least one plot in your presentation that touched on that. Maybe you can elaborate more.
Yes. Can you see this slide?
Yep, we're on your thank you slide, yeah.
Okay, great. Okay, great. So I'll move back to, all right, yeah, so I touched on this just a little bit. So I think, this plot here is for the powdered spices. We found really good correlation between the XRF and the ICP-MS with powdered spices, so within 5% basically. When it came to the roots, we consider that more of a qualitative screening with the XRF, so it's within 20% for those roots. So in this slide here, I was kind of showing, so this plot shows the correlation with the ICP-MS value on the x-axis and the XRF on the y-axis. And sorry, I realized, and then essentially with the colorimetry, however, the roots really only work. So it's kind of, these could be compatible in some ways, where the powders, the XRF is so accurate, and with the roots, the colorimetry is a bit easier and more accurate. So yeah, I hope that helps. So yeah, the short answer is within 5% for powders and within 20% for roots is what we found.
Yeah. For those maybe not used to sort of seeing these kinds of scatter plots, I mean, your R squared there value is almost 99% precision, right? And the slope of 0.95, it's that, within 5 relative percent accuracy there.
Definitely.
That's great. So someone asked about the lead content and parts per billion that you found in Bangladesh in the polished roots. And I think maybe you had a map that showed the relative concentrations. And I was, while you pull that up, I was just going to clarify for those on the call, milligrams per kilogram is the same as ppm, or micrograms per gram is the same as ppm. So sometimes we switch different units of measurement there, but those are interchangeable.
Yes, and maybe they were referring to this plot
Yeah.
potentially. Yes, exactly. So yeah, like you said, we got milligrams per kilogram, micrograms per gram, and parts per million are equivalents. Um, and so yeah, so these what I'm showing here, and actually I realize now that maybe I didn't verbalize this, but the number below is the maximum value we saw. So, you know,
Okay.
in most of these cities, reporting, for example, like a median value or a central tendency value, like a median or mean, would be kind of meaningless because most of them were below detect. And you know, these ones that were positive, we then went and measured with ICP-MS as well to compare, by the way. But yeah, the numbers below are the maximum values. So for example, 2,274 micrograms per gram. So, you know, that's more than 200 times this Indian level. You know, the Bangladesh level was 2.5. The Pakistan level is actually 5. In the US, it's, you know, inching, it gets lower, you know, so every place may have a different value, but, you know, in Nepal, I found 82 to be the highest. Karachi actually had even higher than Bihar, just the proportion of samples. It was 25% of the samples had elevated lead above that 10 micrograms per gram or parts per million. The maximum value was up to 3,000. Does that answer the question actually, or should I
Yeah, I
elaborate?
think so. They actually asked about parts per billion. So you're a whole order of magnitude above the parts per billion level here, which is a real problem. I think we
Right,
could agree.
exactly.
Yeah.
Yeah.
So you mentioned, so they're using this lead chromate, but chromium has its own toxic profile concerns. So the person asked if you use the XRF to test for the lead and the chromium individually, or how maybe they're not familiar with how the XRF reports, and maybe other metals that toxic heavy metals you came in contact in your scanning, besides just lead.
Right, yes. We find the XRF most helpful for us in looking at the lead, actually. Above, you know, with the limit of detection being so low for lead, that we find it's great. I mean, like the limit of detection being 2 parts per million. If we look at 3 standard errors, we're still kind of under that 10 part per million India level, for example. When it comes to chromium, we also look at it, but because the limit of detection is higher, we take it with that information, right? So if we see lead levels, that are 100 plus, we'll see, you know, because it's a molar ratio in lead chromium. It's a molar ratio of lead to chromium, right? So lead is heavier than chromium, and so we look at it's, you know, often it's about a factor of 4 different in terms of parts per million. So we can look at that, you know, if we see 400 parts per million lead, it might be around 100 parts per million chromium, and that would be within the detection. But if we're under 100 parts per million lead or 25 parts per million chromium, we often we'll just double check. Like we've done some of that double checking with the ICP-MS, because that helps us say, you know, at what point, like there's this broader question. If we want to drive lead levels lower, you know, part of the lead in the spices is coming from the soil, like naturally or anthropogenically, right? Like there's naturally some soil in lead in the soil, and then obviously we mine some lead and use it in products, and that comes back to the soil kind of from an industrial pollution perspective. But then the other part is this intentional adulteration. So the lead to chromium ratio of being 1-to-1 is very uncommon in soil. Like typically in soil, we'll see more chromium relative to lead. So we often will drive down, if we're looking at those ranges between, let's say, 10 parts per million or 10 micrograms per gram and 100 micrograms per gram lead, we'll look at the lab results to say, okay, like where do we start to see the molar ratio of lead to chromium being more indicative of lead chromate, to say, okay, you know, if people are developing standards, what's reasonable given the natural contamination from soil, given that these are roots. Like the roots get a lot of soil on them anyway. So we kind of use the XRF and the lab results side by side in that way.
Yeah. And I think that your answers are a good segue to the next question, where they were asking about, lead in the water in India, Sri Lanka, and the surrounding countries. And I think you can extend that question to sort of just natural abundant soil in the water. And do you have a sense for what the baseline lead levels are in there? So what's coming sort of inadvertently versus the adulteration?
Yes. So, I mean, it's hard to say because, these are like, there's a lot of variation, so I can't say across the board. But from our studies, and now we've looked at, I want to say this would be probably from over 1,000 samples from these different countries. Some of the ones I haven't, the stuff in the past couple of years, I didn't include all in, in great detail in my slides. But we see that it seems the soil is lead contamination can be up to 15 to 18 parts per million lead in the turmeric. And then beyond that, we really see this, it's lead chromate, like clearly lead chromate. So between 10, but the India limit is set at 10, right? So there is this gray area, and the Bangladesh limit is set at 2.5. So there is this level that, if people were to enforce that strictly, it would hopefully go back and incentivize agricultural approaches, like more cleaning of the roots, let's say, to get some soil off. So we definitely see that range, up to 18 parts per million that could just be from the soil and not from the lead chromate. Whenever we see something that's 1,000 parts per million, we've always seen chromium. So I mean, yeah, but if that helps.
It's not a smoking gun at that point; it's a smoking cannon, isn't it? Yeah.
Exactly.
But the lead is in the soil that's on the surface. It's not incorporated into this root itself.
Oh, that's a good point. Have we actually, I guess, no, I think okay, so I think the answer to that one is that we haven't done great detail to understand lead uptake of the roots. So we don't entirely know how much, the plant may take up a little bit. It probably isn't taking up a lot of lead. It's probably more just the process-wise contamination. So they dry the turmeric, for example, on the ground, and dust and particles in the air coming. So I view it more along those lines. And there is some uptake of lead from the plant itself, but actually now I'm not sure if it's known how much the plant takes up. It's not like a rice plant, though, with arsenic, for example, where it's taking up like wildly large amounts. So we know that. I forget if it's known scientifically how much it's taking up. But yeah, there's some amount that would be taken up into the flesh of the root. And then I think the rest would be from, topical contamination.
Which is probably easier to take steps to remove, right? Easier to address.
Yes,
If
yeah,
it's on the surface.
yeah, if it's taken up into the and that would be an interesting question, especially if people are trying to enforce lower and lower levels to kind of, better drive that down to understand. Yeah. I mean, some people in Bangladesh also said, the lead chromate is on the roots. People could wash it before eating it, right? But I mean, those industry folks came around, okay, we don't need to add it to begin with, but I think there was this feeling at the beginning too, yeah, like if people wanted to, they could wash it off, or how bad could it be? It's just a sprinkle, but it's just that the lead chromate was so concentrated, unlike the soil, which is kind of the natural background levels of lead in soil, because we've done a bunch of other studies, in Bangladesh would be, 40 to 80 micrograms per gram or milligrams per kilogram or parts per million. That would be kind of the range that we'd see in the lead in the soil. So it's just a small amount of lead in soil, whereas the lead chromate is like 30%, so 300,000 parts per million lead, right? So concentrated, right, or plus. So yeah, a small dusting of soil versus a small dusting of lead chromate result in very different burdens in terms of the lead levels.
Yeah, that's great. Someone was asking here about, maybe you can talk about sort of ease of use of the Vanta, and if special software required, how difficult it was to implement. And I think you had a lot of partners in here with different sort of scientific and non-scientific backgrounds. So maybe you can talk about ease of use in software and
Yeah.
and portability.
Yeah, I mean, honestly, it's been just so. I mean, I think like we haven't had, we always have someone who's trained to use that XRF, but I think they're always like, oh, we're done with training. Okay, we're done. Okay, we can go. I mean, so like generally, it's yeah, this it's been quite easy to use. Our team, once they know the value of the unit, obviously treats it with great care. I mean, they would treat it with great care anyway. We have great team members, but I think we tend to like to use it in the office just because it's a valuable instrument, right? So, but yeah, in terms of ease of use, I mean, we typically have a few people who are trained to operate and use it, but it's been quite straightforward for other people to jump in if someone who was formally trained needs a quick training. And yeah, the teams have been really appreciative of its ease of use. So of the different tools we use, it's straightforward for them. So yeah, I think that's great. I mean, we also download the full spectra at times too, and do some processing like that, and the team has no problem with that. So yeah, I think we've been really happy with the ease of use and point and shoot, but also downloading from the software too. So yeah.
Okay, great. Yeah, and what kind of I think the question was a little bit concerned about the XRF limitations, which I can address in a minute, but what kind of concentration ranges, like maybe more the upper range of lead, did you encounter? You sounds like you got down to 2 ppm on the low side, but how high did you encounter lead with the XRF?
Yeah, so I guess some of them we have, not all the results were here. The maximums tend to be, well, actually it depends. So in the Republic of Georgia, the I don't know if I wrote that on the slide there, but that's one. So um, I mentioned these different researchers who have done some work before, like Dr. Alan Wolf from Harvard, as well as Dr. Paramita Hori from New York City. I read their work, and this was 30 to 50,000 parts per million of lead in spices there. So that was just something that was really, and Dr. Brett Erickson too had done some work after they found really high blood lead levels in that country. So that was the upper limit. Yeah, that we saw lead levels of in those ranges, the thousands of tens and thousands of parts per million. And then in South Asia, we've seen more along the lines, the upper range, I think I mentioned there was around 3,000 parts per million for the powders in that study. And we've seen some a bit higher, but nothing in the Georgia range. And then sometimes, spices are mixed, and in certain places we might see in the hundreds. That is also lead chromate. When we're using the XRF, though, we see, percent lead, or like hundreds of thousands of parts per million lead when we're screening the pigments too, because we also want to know the availability of those pigments, and so we'll go and screen those, and that's a much higher upper bound. So yeah.
Right. And as far as the instrument goes, I can say for those listening in that the XRF can handle basically up to 100% lead. We use this for lead solders and metallic leads where it's at 70, 90, 99% lead. So there's really no upper limit for what the instrument can handle on lead. Let's hope that's never encountered in anything intended for human consumption.
Right.
Yeah.
Definitely.
One question here, and it might be outside of where you've had experience, but maybe you can offer some suggestions where to go. The individual indicated that they sometimes encounter high levels of lead in Mexico, in some of the surrounding areas when they're doing lead poisoning investigations. And they were curious if you've done any work in Mexico, or maybe someone you could connect them with, or any suggestions there for Mexico. You listed some of the other countries that you already have been working in.
Yeah, I can definitely think some good partners in Mexico. I might encourage this person to reach out to me. You can find my email online, and I'm happy to do some connections. So there's been there have been a few different organizations working on the ceramic glaze, for example, in Mexico, and some high levels related to that. Pure Earth is one, and there are others.
Right.
And um, there are a couple of organizations who are expressing interest in doing more work in Mexico too. USAID just commissioned a kind of report around different supply chains, including spices and pigments and paints and ceramics. So they did a section on Mexico. And so I think they also mentioned a few other organizations, and that'd be a really good resource if someone's interested, especially in around the ceramics issue in Mexico. It's an artisan, a smaller scale artisan ceramics studios that are doing this. And so I think yeah, it'd be really great to get some more investment into figuring out how to kind of shift away from, in some of these places, it's a cultural practice too. So kind of like you really need the local, engagement to kind of figure out how to work around this. I've been in workshops where people said, wait, you're telling me to not eat turmeric, and then it's like, no, that's not where we're staying. We're saying we need to work toward getting the lead out of the turmeric, so we know turmeric is safe. Because I think the answer in a lot of these cases is, it cannot be to remove a cultural, commodity or practice or something that's very important, just to figure out how to make it safe. So.
Yeah, and I think that's a good segue to one of the last questions I wanted to pose, which is not so much about XRF, but someone asked about how you earn trust in these local communities. I mean, I was really impressed that you had 500,000 expectant mothers sign up to participate in this. And I just from a sociology standpoint, that seems like a big undertaking. And someone else shared my curiosity on that topic about building trust locally.
Yeah. So sorry. So if I misspoke, 5,000 pregnant women in Bangladesh. Yeah, it's true. It's huge. I mean, these local partners, I mean, we have such incredible teams, and, finding those partners who really care about the topic and have, sometimes community health workers who are already part of the government workforces are involved, and other times it's local nonprofits or local research organizations. But yeah, I think that's like the team is just incredible in Bangladesh, and the other teams I work with. Many of them have been part of this for 10 years now. They were with me from the early studies, and before that they were with my advisor, Dr. Steve Luby, who introduced me to them. So I think, finding these organizations and individuals who just like care a lot about it and are willing to work toward this, and are local and are able to kind of navigate and really kind of get the change from within. So that's the most important part. So yeah, I mean, I think it's a process. I don't have a straightforward answer, except just like finding those partners and sticking with the ones who are really working toward it.
Yeah, local always matters. Getting local.
Yeah, it's huge.
So.
Yeah, it's huge.
Well, very good. I just want to remind everyone, you'll be getting a link to the playback to this webinar, and Dr. Forsyth was kind enough to put her contact information in one of her early slides. So if you have more interest in the work that Stanford's doing in the King Center and Dr. Forsyth specifically, you can reach out to her. If you're interested in XRF and finding out more how it might work with your process, you're welcome to reach out to me. You'll get an email from me as well, michael.hall@evidentscientific.com. I do have one question for you, Dr. Forsyth, before you leave, and this is a personal one for me. As you know, I have young kids, and we've discussed that a little bit. I was curious if you're familiar with this book series, Ordinary People Change the World. Have you seen this
Oh,
book series?
yes.
So they have stories about like Marie Curie and Helen Keller and
Yes.
Jane Goodall and Malaya Yousafzai. I was
Yes.
just wanted to ask a personal favor. When Brad Meltzer writes one of these books about you and how you've changed the world, will you promise to sign a copy for my children?
Oh my gosh. No, I'll have it be Dr. Mahbub Rahman and Dr. Jasmine Sultan. It'll have it'll be the Bangladeshi name on there. Oh, that's very sweet of you. Yeah, that's very good.
All right.
I'll get
Well,
the
we
signature.
thank you for
Yeah.
yeah. Thank you for your presentation today. Thank you even more for the work that you're doing globally to keep us all safe. And we'll be checking in periodically to hear about how your work goes.
All right. Thanks so much. I really appreciate it, and all the support Evidence Scientific has given too. Thank you.
Yep. Our pleasure. Thank you, everyone. Appreciate you joining today.
Bye.